Good afternoon. This is Mayor Turner. I was just wanting to catch you up on what's going on today. Start off with the numbers, just like we do every time. Amarillo is at 329. Lubbock is at 470. Abilene is at 185. What happened in Abilene is that actually coronavirus got into a factory, and some of the workers have been exposed, and so that's why their numbers are up. San Angelo is at 41. Wichita Falls is 62. Midland is at 67. And El Paso is at 645. As of right now, Odessa has 64 active cases. We have tested, and there's 941 negative cases out of the testing, 174 pending results, for a total of 1,179 total tests that have been done in Ector County. Our recovery number has gone up, so we now have 29 that have recovered. Just to let you in, remember when I told you that when somebody recovers, when they get well, they have to wait 10 days to make sure they have no more symptoms of coronavirus before they can go on the recovered list. And our death count is still at 4, and so please continue to pray for those families. Give you a little bit of a update on Medical Center. Medical Center has 4 patients right now in the hospital. They have 9 under investigation, which means they're showing the symptoms, but they haven't got the results back from the test. And they have 40 pending tests right now. So there are 2 patients that are actually in Medical Center that are not from our county. One of them came in from Reeves County, which is Pecos, and one came in from Ward County. Sometimes the smaller hospitals will go ahead and bring those into a bigger hospital that knows how to deal with it a little better. Great news over at ORMC. They have nobody in the hospital with coronavirus. They have none under investigation, and they have 11 results pending. So they're waiting there. Both hospitals are getting ready to open back. Actually, ORMC has already opened up for surgery because when we started this, they put off all what they call elective surgeries. Well, sometimes those are elective and sometimes they're not. Sometimes it needs to be a biopsy, or sometimes it maybe is a stent for somebody's heart or things like that. So both hospitals are starting to open up and allow some surgeries, which is great news. That gets more people back to work, and that's what we need to see. Talk a little bit. As you know, the city budget is made up of 3 parts. One is ad valorem taxes, which are the taxes that we have as property taxes. That's a very small part of our budget. That basically doesn't cover our fire department. So majority of our income that we get as a city is sales tax. Well, with the economy being closed down, we're already looking at the budget leaning up some. And so with the coronavirus still continuing and the expense, we have decided that we're going to close the pools for the summer. I don't think we will be far enough along with coronavirus that we can feel comfortable, and also we have to be able to look at cutting areas where we can cut. It's not something that I wanted to see happen because I know a lot of people enjoy the pools, but between the coronavirus and the budget shortfalls, we've decided we're going to go ahead and close that. Need to let you in on something that happened earlier today. A person got out of the hospital from coronavirus. They were healthy enough to be sent home. Technically, they still had coronavirus. Well, one of their friends took them to a hotel. I don't know the hotel at this point, but we're going to just let them stay at the hotel to keep them away from their family. So that has kind of caused a situation. Health department is all over it. They are tracing who they've been in contact with, and so that is happening. It will be resolved tomorrow. They just want to make sure that they would, everybody's been traced, everybody knows who's been exposed, so they can make sure that everyone is healthy. I want to talk a little bit about something that the health department has done, and I suggest that you go to Ector County Health Department or ectorcounty.com, click on coronavirus, and you can start to see some of the graphs that they put up. This graph right here actually shows you the people that have gotten coronavirus, what age they were, which is a fantastic to be able to kind of show you. Typically 40 and 50-year-olds are getting more coronavirus. Our youngest patient was 4 months old. So, and the olders, not exactly sure what the oldest one was, but they were in the 71 to 80 year range. They also have some things that talk a little bit about who gets it. Talking about 31% of the males. Right now, more women are catching coronavirus than men. You can also see that 72% of the people that are catching coronavirus are Hispanic, because about 60 to 65% of our population is Hispanic. So we expected some of that, but that number is a little bit high for the Hispanic race. So they also talk about some of the people. The average age is 43. Like we said, the youngest person was 4 months old. We have 29 people that have recovered, and 58 people that have caught coronavirus had underlying conditions. And usually what happens there is they're the ones you see go into the hospital. There's also a section that talks about the deaths. We had that was 50-50, so we've had 2 female, 2 male. They were all 4 Hispanic. So the average age was 54. So it gives you kind of just some information on what's going on, and kind of gives you a little bit more insight, which I'm thank the hospital, the health department for doing it. It's fantastic. All of the tests from the Madison nursing home have actually been finished, and so no more cases have been found, just the one case, which is absolutely fantastic. Both hospitals did a great job working together, because I know our sister city, Midland, has had a few problems with cases coming out of their nursing home. So what it means was, luckily they caught that early and didn't allow it to spread. Going tomorrow, I'm going to listen to a press conference from the governor. He is expected to start releasing some stuff and allowing cities to prepare to open. Told you I've been working on a plan. Well, here's the first draft of the plan. It's called Reopen West Texas. We're going through it and making sure that we cover everything we need to cover for different businesses. Whether it's a nail salon, we need to be able to tell them how to protect the customers. We may use a piece of maybe plexiglass or a piece of plastic to where the customer can put their hands through to get their nails put on, and that way there's no somebody sneezes, they're not getting the other person. When we open the economy, it is a very, very good chance that we were going to require masks to go into a retail establishment. Just until we make sure that COVID is slowing down, we are going to do that. Probably first of next week, I'm going to issue a declaration saying that as of right now, we strongly recommend that you wear a mask. We're going to see how that goes. If we see a lot of people still not wearing them, we may require that when the Reopen West Texas plan comes out. And there is talk of hearing it for some retailers that if people do not wear masks, they're not going to be allowed to go into the stores, because that is the reason you wear a mask, is to protect other people. If say I have allergies or I have coronavirus and I'm wearing a mask and I sneeze, it all goes into the mask. It doesn't go around and get everyone else. So CDC is really leaning towards requiring that for a while. It won't be from now on. It may be for 30 days. So that's kind of something that they're talking about. Great news as of today. We have signed a letter and sent it to 7 cities, Amarillo, Lubbock, Odessa, Midland, Abilene, Angelo, and Big Springs have sent a letter to the governor saying that we want to be able to come up with a plan of our own for West Texas. We're not the same as Dallas. We're not the same as Houston. We're not the same as Austin. Some of those cities are really having some high numbers. All in all, West Texas has been very good as far as their numbers. We have, there have been some cities that have hit bumps. Lubbock had them get into 4 nursing homes, and that has affected their numbers. Of course, Abilene had the factory where it got in there and has affected their numbers. But I could not be more proud of West Texas, and especially of Odessa, for everything everyone's done to protect each other, to stay home. I know sometimes your family can drive you nuts when you're around each other too much, but we have been able to keep most of West Texas healthy. When we look at numbers like that, when I say there's nobody at ORMC, that's fantastic. It's fantastic when we only have 4 at Medical Center. So each and every one of you have done a fantastic job. The job's not finished. So we still need to continue to do that and continue to wash your hands. If you're going to touch your face, make sure you wash your hands. Stay 6 feet apart. If someone is ill, they need to stay home and make sure that they're not spreading it everywhere. Just want to say again how much I appreciate the nurses, the truck drivers, all of our retail staffs, our paramedics, our firemen, our police, everybody that's been on the front line taking care of this have risked their own health to protect each and every one of you. And I can't tell you how proud I am to be a mayor where we have heroes that do that. And, nurses, doctors are all amazing because they deal with it directly, and they have to worry about taking it home, and they have to worry about exposing their family. But they do it. They're passionate about it, and couldn't be more proud of them. I'm very proud of our city the way we've done. So, as always, God bless each and every one of you. God bless Odessa. God bless Texas, and God bless the United States. Please continue to stay safe, and I will talk to you tomorrow. Thank you.